until the beginning of October after the budget session. So that's how we will proceed.
As Pam said, we're really happy to have Scott Clardy here today. He's the Assistant Director, if I can get the title right, of the Columbia Boone County Public Health and Human Services. Scott's got a long career in public health, 33 years. I didn't realize, looking up his past, that he's a chemist, and he first started with the Missouri Department of Health at the state lab as a chemist. In fact, his degree's in biochemistry. So that kind of accounts for what I know of Scott when he led studies on lead and environmental issues, because he's a chemist, as well as being a public health practitioner. Scott worked for a number of years at the Missouri Department of Health and Senior Services in a number of areas: communicable disease, immunizations, environmental health, and as I mentioned, the state lab. But we know him as the Assistant Director at Boone County, where he's been for a number of years, and he's made it through a couple years of COVID, right? So here's Scott, and looking forward to hearing from what he has to say. Maybe some cheerful news.
Yeah, right. Let's hope. Thanks, Alice. I appreciate those kind words. Whoever is the coordinator or whatever, yeah, can you give me rights to share my screen, please?
I will, but I think I just admitted a young person from the Missourian. Is that right?
Okay.
Is that true?
Yeah, it is.
Thank you. Good. Okay.
Great, thank you. Glad you're here.
Where did it go? Oh, there we go. Okay, you're the host now, Scott.
Okay.
And if
Okay,
you
here we
happen
go.
to see someone to be admitted, go right ahead and do admit them.
Okay, all right. Okay, so can you see the screen now with the presentation?
can.
Great, great.
Yeah.
Okay, so there's always that moment of hesitancy: is, oh my gosh, is this going to work or not? So thankfully it worked. Well, it's a pleasure to be here today with you guys. You guys have always been so welcoming, and I sure do appreciate that, and look forward to giving you an update on really where, let me admit somebody here, where we're at with the pandemic in Boone County right now. And along with Alice also asked me to talk about some of our efforts regarding mask usage, vaccination, and those types of things. And so we'll go through this, and I'll be happy to answer questions as we go, or there'll be plenty of time afterwards also. So okay, so let's start out talking about a little bit about testing. This is a rolling 14-day average of the number of tests per day. And you can see this, back from the end of March, first part of February, up until the 1st of July, we didn't have much testing, and that's because not that many people were sick. We didn't need it. And then we see the impact of Delta here on our testing. And you can see that we quickly rose in our number of tests, and they're still kind of staying pretty plateaued now. Nothing like what we saw last winter, but we're still getting quite a few tests each day. We aren't doing testing here. We've never actually done testing here at the health department. We've done some testing of homebound folks, but most of the testing is being done at either NU Healthcare has a testing site that you can go online and sign up for an appointment, and they'll get you in to get tested, or you can go to an urgent care center, and I believe some places like Hy-Vee are still doing some testing also. There's also home testing that if you can be lucky enough to find a store that has those stocked, you could get home tests too. So anyway, so our testing is it's come up a little bit, but it has stayed pretty steady. Now let's compare that to our results. So these are positive cases back from when the pandemic started. This goes back to May. So again, here you can see the springtime decrease, which, whoops, I'm so sorry. Let's go back. Okay, can you see that still? I hope. Okay, you can see the springtime decrease here. And then again, here's where COVID started coming up. The good news, the great news is that we are seeing a downward trend in positive cases. That downward trend is, I'm sorry, I need to admit somebody. The downward trend is not nearly as steep as the slope for the increase in cases, but nonetheless, we're going down. The numbers are going down, and we're happy to see that. We think that we have every reason to believe this trend will continue, at least at this point. It's just going to be a slow go at it. But this is evidence, a couple of things here to keep in mind. You know, the Delta variant and what we in the variant or variants that we were dealing with last fall and last winter, while they're both coronaviruses, they're actually two very different situations. The Delta variant is extremely more infectious. It's much easier to spread this. And yet, even with that, we still haven't seen peaks like what we saw last year. I think this is evidence primarily of the impact of vaccine, okay? But it's also the other types of mitigation measures that we have in place or that people are taking. But even though we're seeing an increase here, as a public health person, I am thrilled to see that we aren't seeing anything like what we saw last year with a variant that is much more infectious. So overall, we're seeing the start of a downward trend. Okay, so this is sewer shed data. This is something some of you may not be familiar with, but there's a group at the University of Missouri that is pioneering a look at analyzing wastewater, from like our wastewater treatment plant, analyzing wastewater for COVID, fragments of COVID virus, and seeing if they can use that to predict what we're going to see in the community within the next week or so. This is really groundbreaking. It's really fantastic. They're sampling all over the state. They have made the national news with this. The Good Morning America or Today Show or somebody actually broadcasts from their laboratory at one point during this process. Anyway, so the science is still very new. They haven't said, you can use it to predict anything, or, they're being very careful about advancing it. But nonetheless, you can see that there's clearly, here's our impact of the return of students last year. Here's what we saw over the winter when we had huge numbers of cases in November and December and January. And then sure enough, the first part of July, here we start seeing numbers go up again. The good news is, look at this, they're coming down. And the last date on here is the 13th, that's this right here. We just got the data for the 20th, which would have been last week, and or Monday rather. And the good news is it's even lower now. That we haven't gotten the chart yet. I took this from the chart that they give us, and they haven't updated that chart yet. But the reading for as of Monday is below 100, below 100,000 units. And so that gave me cold chills when I found that out. That's such great news. It's been back into the spring since we've seen numbers that low. So again, we're not necessarily drawing any conclusions, but we are extremely happy to hear that. Hospitalizations, you can see that we had a small number of hospitalizations, and then they started to increase with Delta, but they are coming down again. And so we're really thrilled with that. This the last date on this was actually the 6th. We need to update this, but I can tell you as of yesterday, I think we had like 85 hospitalizations total yesterday. So that would bring that slope or bring that point all the way down to here. So hospitalizations are definitely on their way down. Now this is total hospitalizations in Boone County hospitals, regardless of where the patient resides. We keep an eye on that because that helps us know hospital readiness. Do the hospitals have room to take more COVID patients or not? The orange line here are the number of patients in ICU, and the blue line is the number of patients that are on a ventilator. So again, you can see that it may be not, you can see that we still have a smaller number of, here's like our highest number of ICU patients last winter, and our highest number this year has not been as high. And keep in mind that that vaccine is made to prevent severe disease and hospitalization and death. That's its main goal. It's not going to prevent all disease, but it is working to prevent or to keep our numbers down again on a virus that is very, very bad, and in a situation where we only have half of our community vaccinated. So there's that. So let's talk about the vaccine. So as of right now, according to the state, we have 51.3% of our population that have completed vaccination, and nearly 57% have initiated vaccination. This is the entire population, including those who are not yet eligible for vaccine, those under the age of 12. So that we have one of the highest percentages of any jurisdiction in the state. I think the only place that may be higher than us is the city of Joplin. And so anyway, so we're proud of that, but we've still got a long ways to go. I mean, we're happy that we've been successful, but we still need more people vaccinated. So how have we gotten there? We've worked very closely with other vaccinators in Boone County to coordinate our efforts. These vaccinators have just been a joy to work with. This includes MU Healthcare, Boone Hospital, all the pharmacies across the county, including the Columbia pharmacies, the ones in Ashland and the one in Centralia. And what we do is we meet on a regular basis via Zoom to talk about, how much vaccine we each have. And, we try to coordinate who's going where to give vaccine. So we don't have 3 vaccinators all showing up at the same place at once giving vaccine. That has helped us, I think, get to where we are at this point. That plus MU had an extremely successful mass vaccination event or mass vaccination location there at the football field, Thoreau Field. So, but anyway, that's something that we're doing that when I talk about it on statewide calls, a lot of local health agencies have not done something like that yet. I can't imagine why, but that's definitely turned out to be a best practice for us. We are currently and have been for some time administering 3rd doses to the immunocompromised. We'll talk a little bit more about yesterday's or today's announcement a little bit later in the presentation. So something that, I'm so sorry, I keep going backwards. Yeah, so something that I wanted to make sure you guys know is really as of this week, we have temporarily shifted our focus from giving COVID vaccine to now doing flu vaccine. If you're not aware, we have a program where we do vaccinations in all the public schools in Boone County and many of the private schools too. This has been something that's been really successful for us for many years. We get support from a local foundation along with MU Healthcare to do this. The idea is that parents can get their kids vaccinated without having to take them somewhere else to be vaccinated. And the more people you have in the home vaccinated, the more it protects those who cannot be vaccinated. So if a child, has a 4-month-old sister in the home, that child that infant can't be vaccinated. But the more people that get vaccinated in the home, the better. So we're really excited about that. We didn't get to do it last year, as you know, because the school wasn't there. They weren't in school, but we're going back to it this year. So that's what we're doing now. We're not really doing any COVID vaccinations now. However, there are plenty of places in the community that people can go still to get a COVID vaccination. MU Healthcare has set up a vaccination site for both COVID and flu vaccinations. It's behind Women's and Children's. You can go on their website and find out about that. Hy-Vee is doing vaccinations. I know that I think CVS is doing vaccinations. There's plenty of places. On our website, we have a list of places where people can still go to get vaccinated. So, so that's happening. And then the other thing I wanted to point out, we hear a lot about breakthrough cases, meaning cases of COVID in people who have been vaccinated. But I wanted to point out that not very many people know this, but of all the people who have been vaccinated, fully vaccinated in Boone County, less than 1% of those have had a positive case of COVID after they were vaccinated. So I think that while breakthrough infections are going to happen, and we might all know somebody who's had a breakthrough infection, number one, the fact that it's less than 1% of people who are vaccinated shows that the vaccine is very, is helpful. And while they get sick, I don't know of too many breakthrough cases, maybe a handful, that have actually ended up in the hospital. So again, that's helping prevent that severe disease too. So if you didn't know that, I thought that might be something you'd find interesting. So this kind of shows over time how many doses of vaccine we've given to Boone County residents. The bars here are the actual number each day. The line is the 7-day average. So it kind of smooths out all these peaks and valleys. So you can see that, as you probably knew, we were busiest during the spring, and then things have kind of leveled off since then. Okay, so I thought you might be interested in looking at vaccine coverage rates by age group. So in that 12 to 17 population, we have a little over 54% have initiated vaccination, and not quite 48% have completed that. Now let's compare that to the 18 plus population, where we have almost 67% have initiated and 60.4% have completed vaccination. And then in the 65 plus, you can see that we have almost 88% initiated and a little over 82% who have completed. So it kind of shows, that this 12 to 17 population is still a group that we need to work on, and we'll continue to do that. And I can talk about how I will be talking about some of our efforts, what we've done to work on that already. But it shows that this, that the uptake is not homogeneous throughout the age groups. And it also shows that, some of the efforts to reach this 65 plus population early on seem to have worked. So let's go on. So let's talk about the news that came out yesterday, and I think around midnight tonight or last night, out of the CDC about the booster shot. So a couple things to clarify on this. This is only for people who have received Pfizer vaccine, who have received both doses of their Pfizer vaccine. It's not to say there may not be a booster dose of Moderna or Johnson & Johnson later on, but they're still looking at that. The companies, the manufacturers who make that vaccine are still conducting studies about that and have not presented their data to FDA and CDC yet. Pfizer was ahead on that. So it's Pfizer vaccine only. And if you did get 2 doses of Pfizer vaccine, you have to wait at least 6 months before receiving that booster dose, 6 months since your last dose of Pfizer. So who is eligible now will be those who are 65 and over, those who are residents of a long-term care facility, 50 to 64-year-olds with an underlying medical condition. And, we are expecting soon more guidance from CDC on exactly which underlying medical conditions will qualify. I would expect things like diabetes and respiratory illnesses such as COPD to be those kinds of illnesses. Diabetes has been shown as a risk factor for more severe cases of COVID. And so I think that we'll see that. We haven't gotten that information yet, but once we get it, we'll get that out to folks. They also are recommending 18 to 64-year-olds at increased risk of COVID-19 due to their workplaces or institutional settings. This was where the CDC director disagreed with the recommendations of the immunization committee that CDC uses. That committee did not recommend this, but she did, the director did. So this would take care of folks like who work in healthcare. And then also, this is a very wordy one, 18 to 49-year-olds at high risk of severe COVID-19 due to underlying medical conditions should consider a booster based on an assessment of their individual benefits and risks and consultation with their medical provider. So this is saying that if you're 50 to 64-year-old and you have an underlying medical condition, you should get the booster. If you're 18 to 49 and you have an underlying condition, you should check with your healthcare provider as to whether or not you need a booster or not. So this is all from yesterday and late last night. And then of course, the immunocompromised persons we've already been giving 3rd doses to, that hasn't changed. So that's the news that is hot off the press. So I wanted to talk a little bit about our efforts to encourage vaccination. And Alice, I want to thank you for giving me the opportunity to talk about this, because this is something that we've worked so hard on. You may or may not know that we have been doing lots and lots and lots of what we call outreach clinics, where we go out to different areas of the community, to the people, and have them get vaccinated, instead of expecting them just to come here to the health department, to come to us to be vaccinated. We've done these really beginning back in the spring up and through last week. We were doing those. And if you would indulge me, I want to give you an idea of the variety of types of places that we have been to over that time period. So we've been into lots and lots and lots of schools. Before school let out, we were able to get as many as many students as we could vaccinated that qualified, that were 12 and older. So we've been in lots and lots of schools for that. We've been to community centers throughout the community, or throughout the county. We've been to St. Francis House. We went to the Centralia Car Show. We've held community vaccination events at fire stations. We've been to the library multiple times. We've been to the Islamic Center. We were at the Juneteenth block party. We were at World Refugee Day. We've been to food truck roundups. We were at the Rock the Community event. We have been to City Hall to not only do city employees, but to try to make it convenient for people who might work or be downtown to get vaccinated. We've been to concerts that have been held at Stevens Lake Park. We have a couple times done a mobile unit with Brianna, the county clerk. She has a mobile unit where she can go around and help people get signed up to vote. And she offered that to us, and we have gone on a couple of different occasions, spent a Saturday with her, going from community to community around the county, making vaccine available to folks, and they just have to walk up there to her little bus and we give it to them. And if they want to sign up to vote while they're there, they can do that too. So kudos to Brianna. She's been an amazing partner to work with. We were at the Boone County Fair multiple times, at the Show Me State Games, went to Project Homeless Connect. We were at Como Smoke and Fire. We had we put a notice out on social media and said, look, if you know of a place that would be good for us to go, that you think we could get a lot of people to come and get vaccinated, let us know. And Como Smoke and Fire was one of those places. And I believe if you got vaccinated, you got a gift card or got a free meal or something like that too. So great partners there. Not to mention great barbecue. We went to several farmers markets. We have, I think I mentioned this already, we have done lots and lots and lots of folks who are homebound. We've actually gone out to their homes and given them both their first and second doses in the home. We've been to the Boone County Jail several times. We went to Midway Travel Plaza. We went to the Friendship Missionary Baptist Church a couple of times. Those are absolutely wonderful, beautiful people there. And they are just wonderful to work with, and so appreciative of us being there. We went to the Anchor Fest in Centralia. We've been to the Rose Music Hall, Turning Point, the Welcome Inn. We were at Pride Fest. We were at Booch's. We went to the Harrisburg Christian Church. And then just yesterday was the last time we did one. We went to the picnic for all the city employees. In total, we've given about, just out of the health department here, we've given about 17,000 vaccinations. So, that's a lot, not nearly as many as like what MU Healthcare did at their mass vaccination clinic, but that was designed to be a mass vaccination clinic. And so we're real proud of that. So thank you for indulging me on that. We've also tried to have a very strong social media presence about vaccine. We did a professionally done campaign with some local citizens. I don't remember who all of them were, but I remember that Dr. Ruffin was in that campaign. The idea was try to appeal, to the community with people they might know and who are advocating for getting the vaccine. And then we've also used social media to try to show data, to show people how effective the vaccine is. So we have been, for instance, doing kind of a weekly post saying, during the past so many days, we've had X number of cases, X number of positive cases of COVID in Boone County. Of those, X number of people were unvaccinated, showing that the majority of our cases each week are unvaccinated, are folks who are unvaccinated, so that the vaccine is shown to work. Several companies have stepped up with incentives, and Six Flags over Mid-America down in St. Peters is one of those companies. They contacted the state health department and said, hey, we want to offer free tickets to anybody who gets vaccinated. And so we're doing that. We've got some of those tickets, and anybody who gets vaccinated, if they want a Six Flags ticket, we give that to them. And then also, as was mentioned earlier in the call, the Vaccine Ambassador Program. That's a program. Mari is one of our vaccine ambassadors. I don't know who else, if anybody else on this call is or not, but those are folks who just who want to volunteer to really be educated on the vaccine, so that they can have good conversations with their families, friends, neighbors, whoever, whenever the subject may come up, about what is the true science and what is really true about the vaccine. We have so far, I think it's 57 ambassadors across the county. Of course, we'd love to have more, but we're just thrilled that we have 57 people that have shown so much of an interest to actually volunteer and come forward and do this. So thank you to those folks who are doing this. Okay, so now there's been a lot of interest lately in what's going on in school age kids. What are we seeing there? So this is in 0 to 19-year-olds. I realize school age kids usually just go up to 18-year-olds, but the way that we divide our age groups for counting our data, we actually go up to 19-year-olds. But this shows the number, the rolling 7-day average of Boone County cases in persons aged 0 to 19. And so here's the interesting thing I want to show you. Right about here is when school started in Columbia. Now this is countywide, okay? Right here, started I think on the 24th, so that's right about here. We go a week later and we're starting to see a little bit of an increase, and then we go another week later and look where we're at. So keep in mind that the incubation period for COVID-19 is 14 days. So that means that people could start showing symptoms up to 14 days after they were exposed. So I think we kind of did see a peak here. I'm not going to necessarily say that was because because of going back to school, but I'm just saying that about 2 weeks afterwards is kind of when we started seeing this peak. The good news is we're going down. We're very happy about that. This is clearly a downward trend since that time, since the 2 weeks since school, or since it's 4 weeks basically since school started. So I think this is evidence that the schools are doing a great job doing as CDC recommends and layering mitigation measures, everything from masking to proper cleaning to keeping kids at least 3 feet apart, staying home if they're sick, staying home if you've been quarantining appropriately, if you have been exposed, those types of things. So we're very happy to see this, very happy to see it. Again, this is with a much, much more infectious variant than what we saw last year. So that's great news, that's good news. Thought I would show this too. This is a bit confusing, but I'm gonna try to explain it. This is what we call our cases by age. So down here are all the different age groups that we have, that we look at. And you'll see this gray here, and you can kind of see it like under here. The gray represents what proportion of the population that age group is. So in other words, right here, the 55 to 59-year-olds are about 6% of Boone County's population. So that's kind of what this gray represents. Anywhere where you see red, red is the percentage of our cases in that age group. So anywhere where you see red above gray means that we're seeing more cases in that age group than what we would expect based on their proportion of the population. So basically, so what this is showing is that most of our cases are 49 years of age and younger. We're seeing higher than what we would expect number of cases in those age groups. And that for the ones that are 50 or older, we're seeing less than what we would expect. This would be consistent with what we've seen in vaccinations, okay? The vaccinations are higher among these age groups than they are among these age groups. And absolutely, we've been seeing a majority of our cases in the 18 to 49-year age group for some time, really since Delta hit. This is really concerning here. This is the 18 to 24-year-old age group, the college age group. So we'll keep an eye on that. That's not unexpected. But it's not anything like what we were seeing last year. But down here, in these, here's 5 to 9 year olds up to 18 to up to 17-year-olds. You can see this darker under here. That's their proportion of the population. So we're clearly seeing more cases there than we would expect to see if they were proportional to their portion of the population. But we're still, we're still seeing that downward trend. So this is just some interesting data I thought you all might find interesting. We watch this on a bi-weekly to weekly basis, and it has not changed substantially in quite some time as far as what we're seeing. So Alice asked me to talk about our efforts to encourage mask usage. Again, we've turned quite extensively to social media for this. We do our best to put out good peer-reviewed science out on social media to really counteract all the bad so-called science that's out there. So that's been one way we've done it. We've taken advantage of every media interview that we could to talk about masks. I know we have at least one reporter on here, and some of you have had the opportunity to do interviews, and you know that at the end of the interview, the reporter will usually ask you, is there anything else you'd like us to know about? And so if we haven't talked about masks during that interview, we usually do try to talk about them there. Certainly, the science is clear that masks do decrease spread of the virus. And so that's the message that we are trying to get out. And then we have lots and lots and lots of conversations with school administrators, especially as school was starting back up again. I don't think there's any district in this county where we have not talked to school administrators about what their plans were. The plans are different from district to district because not every district is the same. And so, certainly they've involved us in those decisions, actually just basically seeking guidance from us. We do not mandate that school districts handle situations in any particular way because every district is different. We leave that decision to them, but we make sure they know about what CDC recommendations are, and then they can make decisions based on that. And certainly CDC recommends masks in the classroom. And so we've made sure that they know that. So those are some of our efforts to encourage mask usage. I wanted to give you a little bit of update on our contact tracing efforts. So keep in mind, when we get a new case in, we call that case, we talk to them about what kind of symptoms they had, when their symptoms started, all those different kinds of things. And then we help them identify who their close contacts were. So then the contact tracing is actually talking to those people, the folks that positive cases may have been in contact with. So we are able to currently follow up on about 55 cases today. With our current level of staffing, we can follow up on about 55 per day. And that includes identifying their close contacts. Then we have contact tracers that call all those close contacts and talk to them about what it means to be in quarantine, what that looks like, what they can and can't do, those types of things. And we've worked with schools throughout the community, throughout the county. They're actually conducting their own contact tracing of cases that are identified of students. They do the contact tracing for within that school setting, what students may have been exposed. We do the contact tracing for those students for any contacts they may have had outside of a school setting, like their household contacts and that type of stuff. So the schools have just been wonderful to work with. Some of them use the school nurses, some of them, the principals alone are doing it. Some of them, a variety of staff are doing this contact tracing, but they've been doing a great job. And I think that shows when you look at how the number of cases in schools are going down, that means that what they're doing is working. Occasionally we have so many cases in a day that we cannot contact all those cases that day. And so rather than wait to contact them later, we go ahead and just send them a packet of information, letting them know what they need to do as a positive case to isolate themselves, and then also helping them figure out who their close contacts may be and asking them to contact their close contacts and provide them information about quarantine. That's not the ideal situation, but it's the best that we can do to try to get contacts identified as quickly as possible. which is what the goal is, to get them into quarantine. So that's kind of where we're at with contact tracing. And thanks to Carl and the rest of the city council, they approved us to have continued funding, to continue to fund our staff who are doing that work along with some of our other COVID work, some of our temporary staff that we have, continue funding those for at least another year. So we appreciate that very much. So let's talk about what's on the horizon. What are some things that we see coming down the track that we want to keep an eye on? Certainly, as I mentioned earlier, we want to talk about, or we want to keep an eye on what is the direction that CDC gives us on implementing their latest recommendations for booster shots. Things like, which underlying conditions will qualify people to get a shot, to get a booster, those kinds of things. So, we're kind of waiting with bated breath for that, for when that'll come out. We're on lots of different email listservs and that kind of stuff to try to get that information as soon as possible. We know a lot of people are going to have those questions, as do we. And so we want to get that information out as soon as we get it. We will continue to do surveillance for COVID-19 and continue to watch for any kinds of increases in cases, whether they be overall in the population, in certain age groups, vaccinated versus unvaccinated, all those kinds of things that we do. We will continue to watch for spikes in cases as a whole or in the age groups, as I talked about. And then, the other thing that we're going to continue to watch for are new variants as they come out. The Delta variant was not the first variant that came out. It's just been the most infectious so far. There is a new variant that's out there that we're keeping an eye on. So far, it hasn't been nearly as infectious as Delta, but there's nothing to say that another variant couldn't come out that would be, or God forbid, could even be more infectious than Delta. So, there are state and federal surveillance systems set up to try to catch these variants as soon as they become prevalent, or as soon as we start seeing them in cases. And so we will be keeping an eye out for those kinds of things too. Those are the kinds of things that we worry about. I don't have it on here, but of course we'll keep an eye on what's going on in the school population also. I should have added that, but didn't. So that's kind of a summary on where we are. I wanted to leave plenty of time for questions, and so I didn't go into nearly as much detail on any of this as I can, or as I could have, but that's what we have so far. I'm going to stop the share so we can see each other again. So it doesn't look like there's any questions in the chat. So if anybody has any questions, I'm more than happy to try to answer them. Yes, Catherine.
You're muted, Catherine.
I just said that, and you didn't hear me. I must Thank you, Pam. I was with a Zoom meeting yesterday and about a week ago Wednesday, and all of us people who are very eligible above the age of 65 want to know where to go, and now that we can go, to get that booster. My advice, and I thought it was best for the way one of the women put it, was that we should contact your office. But I don't have social media. I have email and this sort of thing. So I want to know where I can go so I can go tomorrow if I want to get
sure.
my third shot.
So do you obviously have access to the internet. You're on this Zoom call. So I would advise you to go a couple of places. You could go to MU Healthcare's website, and they have a place on there where you can sign up to make an appointment to go get the vaccine. Their vaccination site is behind Women's and Children's Hospital, over on the west side of town. You could check with Hy-Vee, and I don't know if you need an appointment at Hy-Vee or not, but you might check with them. And then we have a couple of CVS pharmacies. I know one's in Target, and I think the other one is in Schnucks. Somebody correct me if I'm wrong about that. I think they're giving them also. Okay. So those would be the places that I would recommend you go to right away, and they're up and going now. So
some of the people here remember how upset I was. I was signed up for MU and I was not getting called. And so that's my choice where to get the information, but I'll check out the others, and thank you. Thank you very much.
Yeah, thank you, Catherine.
Scott,
Mari, did you? Yeah. Yeah, Alice, I'm sorry. So many
Does
people.
the lab at Providence MU Health, you can do walk-in testing. Do you think they give the booster?
No, they don't.
Okay.
That's just a testing site. And Alice, you can try walk-in testing there, but I would just advise people to know that really
No,
they
I've done it
prefer.
twice. You can walk
Okay.
in, no appointment.
Yeah,
And
okay, you can
Health
do
as
that.
well.
I'm just saying that they also have appointments. So if people have made appointments, they will take the people with the appointments before the people who are walk-ins. So you may end up having to wait a while. I just wanted to point that out to folks. That's at the testing site. They have a separate site. Alice, my understanding is so far anyway, it's they don't do both at both. They don't do testing at the vaccine site and they don't do vaccinations at the testing site. However, at the vaccine site, you can get both your COVID and your flu shot, and you can get those both at the same time too. So if you haven't gotten your flu shot yet, get it. I'm sorry, I don't mean to be bossy. I'd recommend you get it. So yeah, Mari, you or Carl, I saw had your hand up.
Yeah, I think we each have a question. My question has to do with breakthrough infections, and this is a question of personal concern, but I recognize that the small percentage that you gave would be people who tested positive after vaccine. But are you aware of any prospective studies of a group of vaccinated people? Because speaking from experience, I had a mild respiratory illness. I did not get tested because this was at the beginning of Delta, and I thought it was just a summer cold. And not being tested and then later being diagnosed clinically, I don't show up in any surveillance system. So I was just wondering whether you're aware of any studies about that, sort of the actual percentage of breakthroughs.
Right. That's a good question, Mari. I mean, I don't know of any local studies like that.
Right.
I would suspect that CDC and NIH are looking at that type of thing, but off the top of my head, no, I could look into it, but I don't know of anything like that off the top of my head, but I'm sure that is something people are looking into.
Kind of the rub, and I guess I'm partly bringing it up to alert other people that if you have even a mild respiratory illness that you don't dream is COVID, you still need to go get tested so that you know.
We have lots of positive cases who say, well, I've been sick for 3 or 4 days, but I just thought it was allergies. Lots and lots of people think that. And so even if you think you're just having allergies, be on the safe side and assume it may be COVID. So, Carl?
Yes, Scott, I just had a question. I'm interested in the trends of the data you presented. Thanks for the presentation. It suggested that we're headed into the winter season. We're not quite there yet. And obviously, if you look at that trend data, Mari even pointed out that we're higher than we were last September at this point.
Yes.
And it's complicated because there's a lot more vaccination, which is effective, and Delta has come on the scene and so on and so forth. And you have a very optimistic viewpoint with respect to the trends. So do I wish, I hope, because we all deserve it. But what do you think about this seasonality of this? And I'm sure that's why you're promoting some of the flu stuff as well. But we could be on the verge of another spike as far as that goes.
Yeah, absolutely. That's why I said, Carl, we keep close eyes on this data. I think, I wouldn't be surprised to start seeing cases go back up in November and December. I don't know how many of you all know this, but something strange happened the end of this summer, in that we started seeing an increase in what we call RSV. It's a rotavirus that primarily infects very small children. You see a lot of that in the winter. I know my daughter had it when she was a baby, but we have been seeing a lot more cases of that recently. That really has me concerned because, between that and the flu and then COVID, we could be setting up for a long winter with people not knowing for sure what they may or may not have. Carl, we've been through one winter season with this. We'll see what happens with this next season. I wouldn't be surprised to see it. Honestly, we see that with these seasonal viruses. You know, we had an extremely mild flu season last year, but I think that's because of all the COVID precautions that everybody was taking, you know. And so I expect the flu season to be worse this year. You know, what we can do is just keep trying to get people vaccinated. I really stick to that being our strongest defense right now. But yeah, that's a good question, Carl. I wouldn't be surprised to see cases start to inch back up when we start getting cold weather and getting into some of these. You know, typically you see the first part of December to the end of March, or I'm sorry, end of January, end of February is typically the highest points of the flu season. I wouldn't be surprised to see some more COVID during that time too.
So Scott, I was going to call on our Missourian reporter to make sure they got their question in, if that's okay.
Of course.
Um,
Did she have a question? I'm sorry.
Mhm.
is she on
Should
mute?
we-
Yeah, if you're asking a question, you're on mute, right? There you go.
Yeah. Can you hear me now?
Yes.
Okay, thanks. So my question is a bit unrelated to this, but you mentioned about vaccination and everything. So there was this general understanding when the Pfizer dose got the FDA approval that it might encourage a lot more people to get vaccinated, but the rates have been relatively slow in comparison. I mean, people are still not getting vaccinated as much as we would want them to be. So do you have any thoughts on that?
You know, my thoughts about this are, I think that certainly anybody who's wanted to be vaccinated should be vaccinated by now. There have been plenty of opportunities for that to happen.
Yeah.
And I think that we've tried to focus our efforts on are the people who are truly vaccine hesitant. The folks who are saying, you know, I don't know if I want to get it or not. I've heard varying so-called science about what I should or shouldn't do. And so we try to focus on those folks, making sure they have the latest information to make their decision on. And I think the fact that if you saw that one chart, you know, where we keep vaccinating less and less people is evidence that we've pretty well gotten everybody vaccinated who wants to be vaccinated and who I think that we're going to be able to convince that they can get vaccinated. I think the people who are left, by and large, are the people who just absolutely don't want to get vaccinated for whatever reason. And, you know, I don't know that we can do a whole lot to change their mind. I would tell you that you're right, that when FDA did give final approval on the Pfizer vaccine, we did not see a significant increase in the number of vaccinations there. And I think it goes back to this same issue about we've really vaccinated the majority of people who want to be vaccinated. What we did see was when we started seeing cases go up again with Delta, then we started seeing some increases in vaccination. So real world increases in cases, I think, will do more to increase vaccination than anything else. So as Carl was talking about, if we start seeing an increase in cases again, I think maybe then we'll start seeing an increase in vaccinations. But it doesn't appear as though the FDA authorization, or I'm sorry, the FDA approval really did a lot to change people's minds and increase vaccinations.
Okay, thank you.
Thank you. Barbara asked in the chat if the Moderna booster is available yet. No, it is not. That is because Moderna is waiting on, we're needing to get more science behind that, looking more at how long it takes the Moderna vaccine to wane, which is, you know, that the protection isn't as much as it could have been, or as it had been earlier. And so once they complete those studies, they'll present that data to FDA and CDC, and they'll make a determination as to whether or not they need a booster from Moderna. They're doing the same kinds of studies for the Johnson & Johnson vaccine. So let's go to Pam. You have your hand up?
That was my question.
Oh, that was your question. Okay, very good. So let's go to Herb.
Thank you. You presented data on different groups in terms of vaccination rates in Boone County, 0 to 17, 18 plus, and 65 plus. 65 plus and 18 plus are not discrete categories. 18 plus includes, it'd be very helpful if you would tell me how many 18 to 64 as a group or subdivisions were vaccinated, so I get a picture of the trend as a whole. You aren't the only one to present it this way, by the way, and it always confuses me.
Okay, let's go on to another question and I'll see if I can get that for you. Let me see what I can get for you. So Kathy, did you have a question?
Yes, my question is, do you have any breakdown on income status of people who are not vaccinated? I was listening to all the places that you've been, and I would say that they are places where you would primarily be reaching higher income or middle income people, but maybe not lower income people. And so I was just wondering if you have any information on the status of income or the breakdown on income of who is not vaccinated.
I don't have that directly for Boone County, no. Where I get this data from is the data that the state puts together for us. And that's not something that they have broken down the data by yet, but I can tell you that overall, the trend is that those of lower socioeconomic status are more likely not to be vaccinated. That's one of the reasons that we've been to places like Turning Point and the Project Homeless Connect and those kinds of places are really to reach out to those people who are experiencing homelessness and get them vaccinated. And then we've been to other places like the Friendship Missionary Baptist Church happens to be in an area that's of lower socioeconomic status, geographically. And so we've gone there too. Certainly, if you have any ideas on other places that we could go to reach that population, we'd want to listen to that. But unfortunately, I don't have that breakdown just for Boone County, but when you look at statewide data, that's certainly the trend. And if I can go back to Herb real quickly. So Herb, same thing, I get this data from the state's dashboard. And unfortunately, the only way they break that down as far as age groups is by total population, the 12 to 17 population, which I gave you, the 12 plus population, 18 plus population, and 65 plus population. So I don't have an option at this point to give you that data the way that you asked for it. And I apologize, I wish I could, but I just don't have that yet, so.
Welcome to Missouri.
Yeah, exactly, unfortunately, yeah. And then Mary Jo and Al, I'm assuming that's Al that has.
Yeah, that's me, Scott. I appreciate the presentation and the information. It's very interesting. Got a couple of quick questions. First, is there any simple test that somebody who's been fully vaccinated can take to find out if they have had COVID?
Just put it down.
Yeah, I mean, you can do an antigen test to see if you currently have or have had COVID. You can do that. You can also look at, you can also do an antibody test. You can have but antibodies, if you've been vaccinated, the antibody test it just measures total antibodies. So it measures antibodies that you may have generated either through a natural infection or through your vaccination. So it wouldn't tell you then if you have if you're unvaccinated, if you're unvaccinated and you do an antibody test and you have antibodies, then that means you've had COVID at some point in time. But if you're vaccinated, the antibody test wouldn't be the best one, but the antigen test could help.
Okay. Second question. We hear a lot about the Delta variant causing all the surge, but at the same time, we drop mask ordinances and distancing guidelines, not just Columbia, but everybody. Has anybody parceled out how much of that surge is due to dropping of those guidelines as opposed to the different variant?
No. That's a great question. And I wish we had a controlled environment where we could study that. But I can tell you in general, the fact that we did drop, a lot of places are dropping a lot of those mitigation measures, and yet we're still not seeing the kind of case rates that we were seeing last winter. That to me shows how effective the vaccine is. And that's the difference between now and last winter is that we have the vaccine now, and we've got a little over 50% of our population vaccinated. So while we haven't done that kind of controlled study theoretically, I think you can see the impact of the vaccine from
Yeah,
that.
thank you.
Yeah, thank you. Let's see, Sue, did you have a question? Sue, I think you're muted, sorry.
Talking to a Canadian cousin, she had an interesting observation, and that was that they do things by provinces, and she's in Ontario, but most of their provinces are now making it mandatory that if you want to go to eat inside a restaurant, or you want to go to a big event, you have to actually display your card and vaccine card. And she said the interesting thing that's happening then is that those are the anti-vaxxers. They're the ones that are then responsible for what they can't do. And it's a totally different approach. So it's not somebody's telling me I have to. It's okay, I believe in this so strongly, I'm not going to do it. So it's
those are what we call disincentives.
Yes,
is what that is,
and it's working very well.
Yeah, I mean, what President Biden, is requiring with federal workers and federal contractors having to be vaccinated, not being able to test out. That's a disincentive. MU Athletics is doing something very similar. So
Okay.
if I understood correctly. So yeah, disincentives, they work. They absolutely work, but not everybody is real happy about having a disincentive forced on them either. So
yeah,
and we do live in Missouri. So
yes, that's
Alice.
I had a breakthrough case. I just walked into the kitchen where my brother apparently had symptoms that I didn't know it. He was eating, so I was exposed. I'm not sure if I had my mask on or not, because I did wear it indoors. It was at my mother's as she was failing. Very easy to get. And then my other brother got it, so we didn't end up going to her funeral. But my question is, I did test negative on my PCR test, which I thought was kind of unusual. And I would like to get an antibody test. Where do I do that?
Alice, that's a good question. We aren't doing those here. If I were you, I think the best thing to do is contact your healthcare provider.
Okay.
About where you can get those. And to be honest, I don't know that those are covered under insurance. You'd want to check into that also.
I think they're doing some
And,
study at the university on this, though.
Okay, yeah. And I'm so sorry to hear about your mother. So sorry.
She was 91.
Carl and Mari, you had your hand up.
Yeah, it's me again. My question has to do with something I read recently, and this was a national estimate, that 1/3 of all Americans have had COVID at this point. And so my question is, to what extent do you think that between the 50 some odd % that have actually completed vaccination and the X number who've already had the disease, is that part of what's dampening the spread, that it's just simply fewer susceptible people now?
Absolutely. Yeah. Mari, right now, unless something's been updated since I've looked at it, CDC is still saying that you can only, if you've had COVID, that really only affords about 90 days worth of immunity that you can count on. Certainly everybody's different. Some people could be longer, some could be shorter. So people who, like I had a nephew who highly conservative, and he had COVID because, he was in college and wasn't careful about what he did. Within 5 days after going back to school last year, he was positive. And so, but because of that, he thought he didn't think he needed to get the vaccine. And I talked to him about that. And I said, that's just not true. You're a smart kid, read the studies yourself. And, that helped because he went ahead and got vaccinated then. But the point is that, it's really, we can only, recommend that gives you immunity for about 90 days. The most immune person is someone who has a breakthrough case, because they have the vaccine protection and they have the natural immunity. So for those first 90 days after you have that, you should be very, very immune at that point, the maximum immunity that you're going to get. So, yeah, does that answer your question? Maureen?
Yes.
Okay, all right, thanks.
Well,
And yeah,
I just wanted
Carl,
to
go
say,
ahead.
I don't want to cut you off. We're just a bit past time. I just wanted to express the appreciation of the entire group. Personally, I know how much work all of this is. You've now appeared a couple of times here. My appreciation for not only you, but the rest of the staff with the county and the city and so on. This is, I mean, it's yeoman's work. We've been through a lot, and I appreciate your optimistic viewpoint. I'm not sure I share all of it, but we'll see. We'll see how that works out. And I just wanted to, so I wanted to thank you and everybody that was here. I didn't want to give any short shrift to Leslie about the nominate. This is just business nominating committee and so on. If anybody has any nominations, certainly feel free to contact David or myself or Mari, any of us. And we will get together and make those appointments. Or if you want to serve on that committee, as far as that goes, we will do that as well. So I appreciate everybody who has been here. I hope you've enjoyed this session as usual. There may be some hands up if I don't know if Mary Jo and Al has anything, and maybe somebody will stay. But thank you very much. Thank you.
Yeah, you're welcome. You're welcome.
We'll
And
see you all
I'm
next
happy to
week.
stay on, Al. If you have a question, I'm happy to try to answer that for you. Did he leave? No, there he is.
I don't.
Al, are you still there? He took his hand down.
Yeah, I don't have any questions.
Oh, okay. All right. Thank you. Kathy, did you have a question?
Ours is raised, you raised yours?
No. Just a pause.
Okay.
I was just clapping for you. I thought it was a.
Oh, very good. Okay. Thank you so much. I appreciate the class. All right. Well, thanks, everybody. Have a wonderful
Thank
rest of your
you.
day and enjoy the weekend. The weather's going to be gorgeous. So.
Bye-bye and stay safe,
Bye-bye.
everybody.
Thank
Bye-bye.
you.